Good afternoon, and thanks for joining us for today's Healthline. I'm Courtney Butts, your host, and Healthline is where we like to focus on ways to live a healthier, happier, and pain-free life. We'll be taking your calls and answering your questions live in the studio today. We'll be opening those phone lines soon, but as a reminder, please make sure you are in a quiet room when you call with your TV turned all the way down so we can hear your question. Our number is 318-219-4569. That number will be on your screen. Today's topic is peripheral arterial disease, and joining me to talk about this subject is Dr. Miles Sugar, a vascular surgeon with Willis Knight Vascular Surgery. Good afternoon, and thanks for joining us, Doctor.
Good afternoon. Thanks for having me.
Awesome. Yeah, so tell me a brief overview of peripheral arterial disease. Kind of sounds a little scary. Tell me what that means.
Sure. So we've got arteries going to every muscle, every organ all over our body, and peripheral arterial disease is when you get disease that starts to narrow or block off those arteries. Most commonly we see that in the legs, and that can lead to pain in the legs, and in worst case scenarios we can see onset of gangrene and limb loss from that.
Gotcha. Yeah, so it can be pretty serious.
Yes.
Yeah. Okay, so symptoms. You mentioned pain in the leg. Any other symptoms associated with this disease? The
most common thing that we see is, so first of all, some folks can have this and be completely asymptomatic. As you develop symptoms, what you see is pain in the legs that specifically gets worse the more you use the legs. So I tell patients it's similar to the feeling you get when you've run too far, but for a patient with peripheral arterial disease, that experience may be walking across the room.
Wow.
As symptoms progress, that pain can happen even at rest, and then after that they can develop wounds and gangrene. Wow.
Okay, so how can we prevent something like this? What are maybe some of those risk factors associated with this disease?
So peripheral arterial disease being kind of a subset of atherosclerosis, a lot of the same risk factors, a lot of the same risk factor modifications that your doctor tells you about for heart disease. So cholesterol management, blood pressure management, and smoking cessation are big key factors to try and limit your exposure to this.
Yeah, that's good advice. And so we mentioned earlier in our 11 a.m. newscast that peripheral artery disease is basically like a form of heart disease, right? Or
so it's atherosclerosis is the hardening of the arteries.
Okay.
And then as the walls of the artery get a plaque buildup in them, it can then start to grow in and narrow the blood vessel. When that happens to the heart, then you see the classic heart disease, heart attack problems like that. But that can happen to other blood vessels throughout the body. And so we can see that happening to the arteries in the leg, we can see that happening to the arteries going to the brain, and depending on which area of the body these arteries are going to, the symptoms can be different.
Similar concept, different parts of the body.
Exactly.
Okay, got it. All right. So atherosclerosis, very big word, and you mentioned causes narrowing of the heart, which can increase your blood pressure and all that stuff. So tell me, like, how does this happen? What is it?
So atherosclerosis it literally means hardening of the arteries, and it's a buildup of plaque and cholesterol that deposits within the wall of the artery. And then as that continues to build up, it can grow into the artery, blocking off flow, similar to clogging your pipes.
Yeah, and you don't want that to happen. No. Okay, so is there any way to diminish the damage, or is it kind of like this has happened to you, there's nothing that you can really do for it?
So once these plaques are established within the arteries, then there's nothing that you can do to undo that. There are things that we as doctors can do to go in and either surgically or with a stent open those arteries back up to give better blood flow. But it's something where the prevention needs to happen before the disease process sets up. Yeah. Modifying your diet after you already get these symptoms will prevent it from going further, but it's not going to undo any of the damage that's already happened.
Yeah, and it's so important. Prevention is key. Better than, treatment. There's a lot of treatment options that I'm sure you offer, but prevention, as you mentioned, is the best way.
Absolutely.
to prevent that from happening. So what are some of those treatment options that you would provide?
So the most common interventions that you see are stents, or what's called an angioplasty with a balloon. It's a needle stick that typically you go in through the arteries in the groin. We go inside the arteries with our instruments, and we're able to prop the arteries back open. If you have more extensive disease, then that's not a good option, and so in that case we do surgical. That can either be done as a surgery where we go in and we directly clean out the artery, or a surgery where if that blockage is too long, instead of cleaning out the whole artery, we reroute blood flow around the blockage and get back into the artery where it's healthy below.
Gotcha. And so take me through the process of cleaning out the artery. I don't know, that sounds very interesting. So what would that entail?
So we make an incision over the artery and we expose the artery. We clamp the artery so that we're no longer getting blood flow through it. And then we slice the artery open. We have special tools that help us kind of scrape all of the plaque out.
Wow.
And then we sew the artery back shut.
Okay. And so do you see a good success rate with something like that?
Yes.
Yeah. Okay. So no more symptoms of, maybe leg pain?
Yes. Depending, once again, on the extent of the disease, we can either help heal wounds, we can decrease the amount of pain, increase walking distance. For some folks, you don't get a complete resolution of their symptoms, but you get a significant lifestyle improvement, and oftentimes what we target to is to save the leg.
Yeah, right. And so is there, in some cases where I think you mentioned this earlier, that you could actually lose the leg due to the loss of blood flow, or how does that work?
Yes, so every organ needs blood flow. And if you don't have blood flow, first what your body does, it relies on what we call collateral arteries, which are small little branches outside of the main arteries that try their best to get blood flow to those tissues. If those are not enough, then the tissue starts to die. And so that is what we call gangrene, and as gangrene sets in, then that results in limb loss.
And that could be, that could also cause a wound as well? Yeah.
Correct.
Okay. So those small arteries are small, but they're mighty, so we need them.
Yes.
Right, okay. And that's as a result from that, the narrowing, the hardening of the arteries from this disease.
Yes,
Yeah.
as I use the analogy of the highways. So as the interstate gets shut down, then you get out onto the smaller highways, you go around, and then that's how you're able to feed your tissues. And as long as that's able to keep up, then the symptoms stay at bay.
Awesome. Well, we have a caller on the line. Ricky, what is your question for our doctor today?
Yes, can you tell me what a left anterior fascicular block is on the heart?
No, so that is, I'm not a heart expert. That particular thing has to do with the electrical conductivity of the heart. I learned about that in med school maybe a decade ago, and I'm not going to pretend that that's in my area of expertise at this point.
Yeah, so vascular doctor talking about all of the things you mentioned, except for brain and heart.
Correct.
Right?
Yeah. So that's a electrical issue, and you've got the plumber.
That's a good analogy. I like that. So you maybe refer to yourself as the human body plumber?
Yeah,
okay.
we're the plumber of the vascular system.
Okay, very interesting. I like that. It makes sense too, because you go out and you got to clean those arteries out sometimes, and when they're blocked from plaque. Okay, cool. So tell me, who is someone that is at most risk for? Is there like a specific population that is at most risk for peripheral artery disease, or is it mostly due to lifestyle?
It's due to lifestyle, and the risk accumulates with age. So usually the patients who have this are older and typically have had those lifestyle risk factors for some time. So it's the person who's been smoking for 30, 40 years is typically the one who comes in with the leg pain. Less so a younger patient who just tried their first cigarette.
Right, yeah. So how is this diagnosed? Let's say I'm a patient and I'm like, I have this leg pain. How would you know then if I had this disease?
So the first thing we do is a physical exam, and you're checking pulses because you can feel the heartbeat all the way down into the foot if the arteries are open. And so if I can feel a good pulse in your foot, then I can tell you you've got excellent blood flow and we've got low risk of that. Moving on from there, then there's a series of ultrasound tests that we can do to actually look at the blood flow through the arteries and see, are we seeing evidence of narrowings, evidence of blockages based on that. If we see suspicion on that, then the next step is the arteriogram. The arteriogram is part of that stenting procedure. So it's a needle stick, once again, typically in the groin. We go inside the artery, and using x-rays and injecting contrast directly into the artery, we can see exactly where those blockages are and make a plan to treat. And in some cases, we can treat right then and there. Other times, we make a plan to go back and do treatment later.
Gotcha. So you mentioned you can check for a pulse, and you said the foot. Can someone do that at home if they're suspicious and then come to you if they're like not feeling anything, or you just would defer to a physician at that point?
If it's definitely there, you can definitely feel it. You can be fooled by, if you wiggle your toes, you can feel the tendons in the foot, and so you can fool yourself with that. You can also, if you're pushing hard enough to try and feel the pulse in your foot, instead feel the pulse from your fingertips.
Oh, okay.
And so you can be fooled. I would defer to a medical expert on that.
Yeah, I agree with that. Well, so that's good advice. So we've talked about some treatment options, but let's go a little deeper. What are some other effective treatment options that you might provide for peripheral artery disease?
So treatment options depends on the severity of your symptoms. So for someone who has pain when they're walking, goes away with rest, it's going to be addressing those lifestyle factors, so smoking cessation, management of cholesterol and blood pressure, and then it's a walking program. Similar to training for that marathon, instead we're training for that walk across the room. And so as you're walking more, you're encouraging more of those collateral blood vessels to be involved, and you can increase your walking distance simply by training and practicing. Once we get to the point where that pain interferes with your day-to-day life, then that's going to require some sort of intervention, either with a stent or with a surgery. And if you have pain that doesn't go away, that's definitely not going to get better just with lifestyle modification. That needs surgical address.
So you mentioned a good point. So instead of, if you do have that pain, it might not be a good idea to rest. It might actually be a good idea to be more active, right?
Yes, so you don't want to be miserable, so you want to rest, definitely, but you want to train. It's the same way you would try to get better at anything, is to do that and try to push your limits. So what we recommend is you walk until the pain starts, rest until the pain starts to go away, and then start walking again until it starts again. And set yourself a distance that you want as a goal, and keep working towards that distance with that stop, start, until you find that you're able to walk that distance.
And listening to your body, of course, making sure not overextending too. So is something like this peripheral arterial disease hereditary, or is it mostly, we keep talking about the lifestyle factors, is it mostly due to those lifestyle factors?
There are some hereditary components, but they're much more, it's a lifestyle. Smoking, if cigarettes went away, I may be out of a job. So that there's definitely a hereditary component to it, but the majority of it is based on the American lifestyle.
Yeah, so tell me, how does nicotine, in cigarettes, how does that affect your arteries?
It prompts the atherosclerotic process. And so the more you smoke, the more the arteries start to harden and then start to build up these plaques that then block off the arteries. I don't have a very good mechanism for that. That's something I think that's still being looked at. But we know that the more tobacco, leads to more peripheral arterial disease. And it also affects the success of our interventions, where if you have a patient that you've done these surgeries on, as they continue to smoke, their arteries will continue to block back up.
Good to know. So if you're just joining us and you have a question for our doctor, we have Dr. Miles Sugar here with Willis-Knighton Vascular Surgery. We're talking about peripheral arterial disease. If you have a question, give us a call at 318-219-4569. And cholesterol is something that's talked about all the time. Your lipid panel, cholesterol, triglycerides, LDL, HDL. Does this affect your vascular health?
Yes, so cholesterol definitely affects your vascular health. One of the main medicines that we use for that is a class of drugs called the statins. And we've actually found that these drugs, even independent of their effect on your cholesterol panel, affects the buildup of these plaques. So for folks as they are developing atherosclerosis and developing these plaques, even if they have a normal lipid panel, we still recommend these medicines because it has a still yet unknown effect that decreases the buildup of these plaques.
Interesting. So if they have peripheral arterial disease but their lipids are perfect, you would still recommend a statin. Is that kind of what you're saying?
That's correct.
Okay. And so you prescribe that as well. That's one of your treatment options, or is that more another physician in their care team?
That's usually the role of the primary care physician. That's something that if I see someone who has a normal lipid panel but has severe peripheral arterial disease, I'll definitely communicate that with their with their primary care doctor. But all medicines have side effects, and so if you have a primary care doctor who knows your body and knows what medicines are best for you, I'll defer that to their care.
Gotcha. So again, reiterating prevention. So we'll go through again, what are strategies that someone can implement right now? Stop smoking, right?
That's number one.
Number one, okay. What are some other maybe top 5? So we've got smoking, or you don't have to reach 5, but the biggies that you would suggest.
So the number one, probably number 1 and number 2 is stop smoking. After that, it's the same things that your heart doctor or your primary care doctor would recommend for heart health. A baby aspirin a day, keeping active, blood pressure control, cholesterol control, and a healthy diet. So nothing earth-shattering. It's the same things that probably every doctor tells you to do, but it affects not just the heart, which is what we think of, but also the arteries throughout the body.
Yeah, I know it's like we sound like a broken record over here. I think we all know that, but it is kind of hard to maybe implement sometimes, especially when the westernized diet, it tastes so good and very decadent and palatable, and so it's pretty hard to cut back on that. And even smoking can be kind of a little addicting too.
It's a easier habit to say to stop than it is to stop.
Right. Yeah. Well, we have Jean on the line. Jean, thanks for joining us. And what is your question for Dr. Sugar today?
Yes. Well, since he's vascular, I think he'll be able to answer this. I have chronic vascular insufficiency, and I was wondering at what point you have the surgical option is the way to go. At this point, I'm having chronic foot pain, and I've had edema since April a year ago. Right now, it's mainly my feet, and it's just almost too painful to walk.
Okay. What that sounds like to me as you're describing it is a chronic venous insufficiency. So that is something that I could speak to that's separate from arterial disease. It's kind of the opposite problem. So the arteries are responsible for bringing blood to feed all the tissues. The veins are then responsible for bringing that blood back to the heart to be recirculated. And when you have problems with the veins not working correctly, then instead of not getting enough blood flow to an organ, you've got blood that's not moving on. And so that then can result in the swelling and edema, and result in a fullness, a heaviness, a pain usually in the calves or in the feet, and can also result in ulcers if left untreated. The primary treatment for that is compression stockings, as simple as that sounds. There are surgical interventions for that. treating some of the veins where the blood is flowing in the wrong direction. Definitely, if you're having pain and swelling, that's something that you can seek medical attention for, and there may be something we can do to improve. But in the meantime, compression stockings and elevating the legs will help the symptoms quite a bit.
And so at what point do you intervene with like a surgical procedure?
So pain that doesn't improve with wearing compression regularly is something that we would then work up to see if you're a candidate for some of these procedures.
Okay.
So with you, as you're saying, you're having this pain frequently, that's something that we would, if the level of symptoms you're having now persists, even with wearing compression stockings, then that's something that we would start to work up as a possible surgical candidate.
All right, thank you very much.
Good to know. Thanks for your question, Jean. And so, there's a lot of advancements with surgery nowadays. With your career as a vascular surgeon, what are some of those advancements that maybe you've seen in your career as a doctor?
Sure. So back to our last caller talking about the venous insufficiency. That was traditionally treated with a procedure called vein stripping. And it's something where, as you describe it sounds somewhat barbaric, and you remove the vein that's causing those problems by, in general, ripping it out. There are now procedures and instruments developed where you can go in leaving that vein in place but sealing that vein shut, either with some sort of a heat source or even with a glue gun now, to, instead of having to remove the vein, we can just seal it and get the same effect.
Interesting.
The treatment of arterial disease, the different types of stents, and we have, going back to our plumber analogy, different rotor-rooter devices that we can use to clean out the plaques, and those are constantly being developed in advance.
So how do you determine if someone needs like a stent or the cleaning out of the artery? Does it just depend on the prognosis or the extent of the disease? How do you determine what kind of surgery you're going to do for a peripheral arterial disease?
Sure. So when you're looking at stenting versus some of the rotor-rooter type devices, that's going to depend on where the blockage or the narrowing is and how hard it looks. As we talk about hardening of the arteries, some arteries get blocked off with a softer plaque, others get very calcified and very hard. And so some of those respond better to different instruments. Then talking about surgery versus stent, there are some places in the body that are not safe to put stents, either because they're places where the body bends, so in the groin or behind the knee, and you don't want to crack that stent with repeated bending, or it's an area that you've got multiple branches coming off. Those need open surgery, and then ones that have failed stenting before, then those are the ones that also would need open surgery.
Very interesting. Thanks for distinguishing that. We also have Vicki on the line. Thanks for joining us, Vicki. And what is your question for Dr. Sugar today?
I would like to ask about varicose veins that he treats that.
I'm sorry, I'm having trouble hearing you.
I think she mentioned varicose veins.
Yeah, varicose veins.
Okay, so varicose veins are a part of that venous insufficiency disease process that we talked about with our last caller. So some folks, instead of getting the swelling and pain, instead get the veins themselves bulge out and get engorged. And that's the varicose veins. A lot of the treatment options are the same for that. There are some more treatment options for addressing those individual veins. But first, the mainstay, once again, is the compression stockings. And then we would look to see if we can find the cause of that. Which vein is it that's causing the extra pressure to get into the legs, and treat that. And then if we need to go and treat those individual veins, we would do that as well.
Okay, and you treat that too, so I can go and see you?
So I treat the varicose veins kind of in the setting of this venous insufficiency. So if you're having pain with varicose veins or sores or things like that, as far as the cosmetic aspect of varicose veins, that's not something that I treat.
Okay. In which WK hospital you are in, Dr. Sugar?
Are you asking where the hospital is, like where he's at?
What is it? Yes, yes. What is his address?
Where are you located?
Oh, I'm at Willis Knighton North on Greenwood Road.
Thank you. I appreciate it. Thank you
Okay.
for your answer.
Thank you, Vicki. We appreciate it. Yeah. Okay. So with peripheral arterial disease, you know, when you think about like a heart attack or something, that could be very deadly. Can something like peripheral arterial disease also be deadly as well?
Yes. So the main risk that we see in patients with peripheral arterial disease is actually heart-related mortality. Because it's the same disease process. So if you've got it in the legs, you may also have it in the heart. Mm-hmm. And so the thing that would be a life-threatening risk is the heart disease. With the gangrene in the legs, though, if that becomes what we call wet gangrene or infected gangrene, then that can cause a life-threatening infection. So that would be the other main risk that we see, life-threatening risk with peripheral arterial
Yeah, so
disease.
definitely want to be on top of it, especially once you start noticing those symptoms.
Correct.
Okay, so we have Linda on the line. Linda, what is your question for Dr. Sugar today?
Okay.
Hello,
Okay,
Linda, can
I
you
would
hear me?
like to ask. Yes, I can hear you. Can you hear me?
Yes, ma'am.
Can you hear me?
Yes.
Okay, my legs hurt. Can you listen?
Yes.
Okay, good. I'm hearing a echo. Honey, I can hear an echo. That's all I can hear is me.
You might
But anyway, my legs
turn down.
hurt from the knees down, totally, onto my feet. They hurt all the time. I have had a doctor already stick needles in my legs, and they say it's my veins. I mean, not my veins, but my nerves. So what do you do in a case like that?
So with nerve-related leg pain, that is so you can have nerve-related leg pain and artery-related leg pain both at the same time. But if you have a medical professional who has looked at your legs and done studies and determined that the source of your pain is from your nerves, I would follow their advice. That's kind of as I quipped earlier, you've got an electrical question and you've got the plumber on the phone. But definitely want to make sure that it's not also peripheral arterial disease. And so if your doctor is also checking for pulses in the leg, that would be able to rule that out and make sure that you're following the right workup.
Gotcha. All right, thank you, Linda, for your question. We've got just a couple minutes left. So peripheral arterial disease is something that you treat here in Shreveport. So if someone is interested and they have maybe some of these symptoms that we've mentioned throughout our show or our newscast today, where can they find you? And do you have a phone number or a website or a Facebook page, that kind of thing?
Sure. So I am located at Willis Knighton North over on Greenwood Road. If I can find my phone number here.
And if not, I mean, Google's great too.
We are at 212-8177, and my office is at 2551 Greenwood Road.
Great. Awesome. So if someone had a question about this and they're like, I really want to know what this is, how quick can they get in with you? Do they just call that number and ask for that appointment, or do they need a referral?
So we accept self-referrals, so if you've got questions or concerns, definitely call the office. And we will get you in as soon as we can, usually within a couple of weeks.
Okay, and then you'll meet with them to determine the plan. Like, okay, do we need surgery, or are we, maybe workup, diagnoses, all that good stuff?
Yes, so we meet in the office, we do an exam, we talk about what we are looking at, what we're suspicious of, and we go from there.
Awesome. Well, great. Well, thank you, Dr. Sugar. It's very nice to meet you. Learned a lot about peripheral arterial disease. And if you're just tuning in and you want to listen or re-listen to today's Healthline 3, you can listen to it on our KTBS 3 podcast. Just visit ktbs.com/Healthline, and that's the number 3, Healthline 3. Thank you for your time again, and we hope that you have a happy and a healthy day.